Today for COVID-19 Worldview, we're talking to Faith Akovi Cooper, who is the country director at the International Rescue Committee in Liberia, West Africa.
Lawton, it's wonderful to be on the show today. I've been following what you're doing on Imported Dreams. I love the interviews. I love to hear the stories. So today, given what's happening globally around the world, we're in an unprecedented time. So I'm happy to share stories from Liberia on this COVID-19 worldview. So thanks for the invitation. I'm happy to be here.
Thank you so much. So basically, we're just going to focus the questions around your personal experience. I know you're in a unique position because you're more involved than probably just the typical Liberian, but just based on your current knowledge, like where does Liberia stand with regards to cases and things like that right now with COVID?
Great, thank you for that. To be quite frank, Liberia is fighting, as is the rest of the world. But having said that, let me share with you a bit where we are in Liberia. And I want to be clear, I don't represent the government of Liberia, and I am not speaking on behalf of the government. I am sharing my personal experiences with you, a background in emergency management, which has given me the opportunity to be able to provide some technical support to the response. More importantly, heading an organization in Liberia, such as the International Rescue Committee, which has a humanitarian mandate, crisis response. We care for the most vulnerable people. We are committed to bringing them from harm to home. IRC is playing a critical role in providing operational support, technical support, and material support, getting IPC materials out to health facilities. The first COVID-19 case was confirmed here in Liberia on March 16th. That was the index case by a Liberian government official who was returning from Europe, where he is believed to have been infected. Whether he was the first case or the first one diagnosed at this point in time, we're uncertain about that. But where we are today, I'm giving you numbers as of April 29th, so about 2 days old. It takes a few days for actual updating to happen. But I do want to share that as of the 29th, Liberia reported 152 cases. And of that, we have about 16 deaths thus far. What does that mean? That means that there is community transmission in Liberia and it's increasing. So from the first imported case, we're now seeing a steady increase of community transmission, primarily in and around Monrovia. And the fact that it's concentrated in Monrovia, we truly have cause to be worried, and we really need to look at a collective effort in which every citizen, every institution and entity can support the government, the bilateral partners, the multilateral partners, and so forth, in responding swiftly to COVID-19.
So Faith, what is the current country's response to COVID-19? Are you guys using social distancing, or how is Liberia handling that?
Thank you. Liberia is doing a mix of strategy, to be quite frank, both borrowing from the Ebola experience somewhat, and then just some of the evidence-based practices that are out there. But not everything necessary. What works in the West may not necessarily work here. So let me start by saying Liberia has set up a National Incident Management System, the IMS, that's co-chaired by both the Minister of Health as well as the Chief Medical Officer of Liberia, and then with technical support from the National Public Health Institute of Liberia. The first case was confirmed on March 16th. Since then, the president announced a state of emergency the same day. Schools were locked down, public facilities, and immediately following that, there was also a lockdown put in place. In other places, in other parts of the world, we say shelter in. But the whole idea of sheltering in doesn't necessarily work for our context, primarily for the continent of Africa, or even specifically here. So what happens is that amidst the lockdown, folks are allowed out about 1 hour a day to pick up essential drugs, supplies, food items. Yes, there is advocacy for social distancing, but does social distancing really work in this context when you have some homes that have up to 6, 7 in a bedroom? I'm not just saying in a house or apartment or in a bedroom. So it's difficult to really apply it to this context in Liberia, but I would say the Liberian population is generally resilient. I think what is missing in terms of strengthening the response effort and strengthening coordination overall is the need to enhance risk communication.
You know, so I'm glad that you brought that point up. And I think that like the Ebola experience has been something that Liberia, that's a positive thing. I know it was a difficult time for our country and for Liberia, but I do think that that was a type of experience that Liberia can use as leverage, you know what I'm saying, with this pandemic. Yeah.
Absolutely.
Yeah. So my other question is, you know, you personally, like, how are you guys, how's your family dealing with it? I know you have some little ones, so I'm just curious how you're dealing with it.
I know, you know, that question it's so relative, right? It depends on the day, it depends on the time. To be honest, you know, I moved home almost 3 years ago now, out of passion, wanting to work in Liberia. So there is this mixed emotions. You know, you hear about the challenges within our health system, our ability to adequately respond or to provide severe acute care for those cases that may be considered severe, as we've seen in other parts of the world. So I worry about that. You know, I'm here with my children, 2 little girls, 2 beautiful girls, Alana and Gigi. I believe they're probably listening through the door. You know them enough to know they're probably peeking to hear what mommy is saying. But honestly, kids are resilient. There are days where I feel it's more than I can handle, but then there are other days where I say, I've been practicing for this, in a sense that my entire career has been around pandemic planning, preparedness, emergency management. So here's an opportunity to give back, and I'm happy to be able to do it in Liberia. But overall, we're being as resilient as we can be, and my children, God bless their heart. They've been wonderful since the start of the outbreak here in Liberia, and they know mom is busy. Mom is constantly on phone calls as the rest of the world go virtual. There are days where mom is engaging, so I have to keep a distance from them, but I'm quite you know, I'm okay with balancing that. So depending on the day you ask, I could tell you I'm fantastic, or I could tell you I'm frustrated, and it's okay to be a little bit of both.
One of the things that we do in the US is a lot of the Black Americans have a nickname for COVID-19. They call it Rona.
Rona. I got to tell you about Liberia.
So that's what I would like to know. What is Liberia's nickname for COVID?
Liberia's nickname, I've heard everything, but one of the most popular ones out there is Koro. You know, our people know how to come up with nicknames. So while the Black community in the US calls it Rona, here they call it Koro.
That is too funny. I knew Liberia had.
There had to be a name. You know Liberia.
So with your background, I mean, we're going to wrap up now, but you know, the disaster preparedness that you did with the ECOWAS countries, you know, being a part of that, that was really great. You know, thank you for that opportunity. What are you doing now with some of those countries? Are you in contact with some of those other people that you work with in Ghana?
Yes, the Kofi Annan Center. As you stated, we train 15 countries collectively, including where countries may have replicated it. A total of 1,400 you know, benefited from the WATP project. I think one of the most critically important things that came out of WATP is this pool of subject matter experts on the continent of Africa. The plan developed during the WATP training is what was modified to create a national COVID-19 preparedness and response plan. So it's fascinating to have this cohort of experts, people working in the field throughout West, East, you know, throughout the continent.
Faith, I just want to thank you so much for giving that comprehensive view of what's going on in Liberia. We do, and you know, of course, me personally, I'm watching to see how things unfold. And all the challenges that you guys are having there, the same thing is happening in the US. And I know sometimes the US is like a beacon for some of these other countries, you know, to kind of see how we're handling it. But maybe this is an opportunity for everybody to kind of come up with their own strategy that works best for their countries. But what COVID-19 Worldview wants to do is give all, you know, my personal friends and family members around the world, give us an opportunity to share our experience. Like, even though we're handling this thing, you know, individually, we're still together. And I really appreciate you taking the time to support this initiative. And yeah, hope to talk to you soon.
Thank you, Love. Thank you, Lata, and I appreciate you for having me on the show and to share what's happening, what's unfolding in Liberia. I couldn't agree with you more. I think we are stronger together. We need a collective effort, and we need a unified effort in order to be able to flatten the curve globally, not just here in Liberia. So I encourage everyone to be a part of this in whatever way that you can. If it means virtually educating your community, if it means reaching out to family and friends, we must all play our part. We have a moral responsibility to do more and to ensure Liberia becomes COVID-free, the continent of Africa becomes COVID-free, and the world becomes COVID-free. Africa needs to look for solutions to Africa's problem, and this is an opportunity. So we will come out of this with some strategies and I think a better approach as to how we move the continent forward. So thank you for shining light on Liberia. And it's always a pleasure to speak with you. You always find such incredible ways of connecting people all over the world. So I'm incredibly honored to be here with you today.
Thank you, Faith. Thank you so much.